In this video, I'm going to be talking a little bit more in depth about a composite tray setup. A composite tray setup is going to look similar to this. It may not have as many instruments on it. It may honestly have quite less, but I'm going to go into detail about the instruments that you may see on a composite tray that your dentist will use. First, I'm going to start off with our 2x2 gauze and our cotton tip applicator. These are going to be used to place topical gel before the dentist administers the anesthetic. Next, I have cotton rolls. These can be used for isolation and absorption to help retract that cheek during a procedure. Then I'm going to go into our anesthetic syringe, carpules, and needle. This is our anesthetic carpule. These are our anesthetic needles, and this is our anesthetic syringe. How your dentist uses this yellow or blue needle may be different. I have seen the yellow be used for posterior teeth and the blue used for anterior teeth. Or I have also seen that the yellow is used for a mandibular injection, whereas the blue is used for a maxillary injection. Along with our anesthetic syringe, we have a needle capper. This is very helpful for you to help recap your needle so that way you don't poke yourself with the needle. I'm gonna go into our handpieces now. This is our high-speed handpiece. Only the dentist is allowed to use this. It has a push button back here for where you can insert your burr. Water shoots out of this so that way it can help keep the tooth cool during a procedure. These next two parts here are going to assemble our slow speed handpiece. This here is our slow speed motor, and this is our contra angle attachment. You put these together here, and this makes our slow speed. Our contra angle attachment does have a latch back mechanism here for you to fit your burr in and lock it into place. This is our air water syringe tip. We have cotton pliers, which are going to be used to pick up and move materials or cotton rolls or anything that we need. These are a very universal instrument. I also have here an intraoral mouth mirror, which is used for indirect vision and retraction. Next is our Explorer. Then we have our spoon excavator. Our spoon excavator looks like it has a little spoon on both ends of it, and this is to remove carious dentin. So remember, dentin is that surface that is under the enamel of the tooth. Next is our plastic instrument. Our plastic instrument does look like a hockey stick on both ends. That's really a good identifying factor for this. This is used to move and place material. Next, I have our condenser. So our condenser is used to condense. It is used to pack material and anything else into our cavity prep. Next, we have our football burnisher. Kind of looks like it does have a football end to it. Our burnishers are going to be used to smooth and can also be used to help contour and matrix band. This here is our prime and bond, or our bonding agent. This acts as an adhesive to help the material or anything stick better to the tooth. With our prime and bond, we will put little drops into this here, which is our mixing well, and we will use our micro brush, which is this skinny blue thing that has a little small kind of like fuzzy tip on the end of it to help apply it onto the tooth. Next, I'm going to go into our Tafelmeyer retainer and our matrix band. So this Tafelmeyer retainer is going to be used to replace the missing wall of a posterior tooth. This goes along with our matrix band, which helps us recreate the wall of that missing tooth, and our wood wedges. We also have this thin clear strip. I know it's kind of hard to see, but this is called a mylar strip. This is what you use to replace the missing wall of an anterior tooth. We also have our articulating paper. This is going to be used to help check the patient's bite to see if there's any high points and can tell us where we need to adjust so that way the patient doesn't crack a tooth, break the filling, and has the best comfort after a procedure. This here is our floss. Our floss is going to be used at the end of a procedure so that way the dentist or dental assistant can floss the mesial and distal contacts of the tooth. A finishing strip. This finishing strip is almost like sandpaper here, but this will be used to help smooth those walls and edges of a filling once it has been completed. This here is our etch. Etch is a phosphoric acid This is going to be used to help remove the smear layer of a tooth and make it white and chalky, so that way things can stick better to it. Here I also have our Limelight. Limelight is a cavity liner. It's a glass ionomer. This is going to be used and placed on the deepest part of that cavity prep to protect the pulp, which is also known as the nerve. Lastly, this is our two types of composite. We have a flowable composite here, and then we also have a packable composite, which is in here, and then our packable composite gun.